Welcome back to Wellness for Life. I am here today with David Gottenberg of Gottenberg Chiropractic Clinic in Pelican Rapids in Menahga. Today we're going to talk about low back pain. David, what can you tell us about this complex issue that so many people struggle with?
Yeah, thanks. You know, there are so many different causes and there are so many different types of low back pain. So today I'm just going to move past disc pain, and I want to talk about that very low joint in the low back called the sacroiliac joint. And this is often a joint that when I ask people to describe it, they describe it as hip pain. But what we really want to talk about is this joint in the very lowest part of the low back.
You had mentioned that that joint is a little bit different. What are some of the common symptoms or complaints that you hear from patients?
Yeah, what I'd like to do is, I think to better understand some of the more common symptoms, probably is a good idea to understand how this joint works. And what I'm talking about is the sacroiliac joint. This is the sacrum, the wedge-shaped bone, and this is the ilium. And so most people don't understand that each and every step that we take, this joint moves, so moves back and forth. So some of the more common types of complaints might be unchanging low back pain that's centered over the SI joint. It may irritate the muscles in the hip or buttock area, so hip or buttock pain. And it's very close to the sciatic nerve, which explains why some people develop leg pain.
So if I understand correctly, the sciatic nerve runs right through that joint?
That's a good question. The sciatic nerve exits very close to the sacroiliac joint, and this nerve then continues down the back of the leg where right behind the knee it splits and then extends all the way to the heel and forefoot.
So what are some things that we do that cause lower back pain?
Some of the more common causes would be working bent at the waist for a long time, long sitting, especially if the chair doesn't fit you correctly, so posture is very important. Your history, in other words, has there been injury? And then the other thing that a lot of people forget about is pregnancy, because in the last 2 or 3 months of the pregnancy, when the body is flooded with progesterone, that causes the ligaments that support the joint to loosen or weaken. And anytime we develop something like that, we develop joint play or instability.
So for a person who's struggling with lower back pain, where do you start with them? How do you begin to treat them?
In addition to really talking to them about their causes, one of the other things that we really want to look at with a person is their gait, even considering whether or not they have a flat instep or short leg. That being said, I really have some strong opinions on how a person should be adjusted and the method to do that adjusting. We offer suggestions on how you sit and should be sitting, how you sleep, some good icing techniques, stretching techniques specifically to the hip and lower back, and finally supporting or bracing the joint.
Thank you for joining us today. If you or someone you know is struggling with lower back pain issues, be sure to stop in and visit with David and see how he can help you. Join us again next time.